Hi, my name is Wala, and I'll be presenting on the economic burden of healthcare-associated infections in Malawi, focusing on patients' costs. So highs are one of the leading causes of death amongst hospitalized patients, and this burden is much worse in low-income countries such as mine, which is Malawi. We recruited participants from a matched cohort study where admitted patients with infection were matched to those without, and we asked these patients about their direct and indirect costs faced during their entire hospital stay. We recruited 320 participants, and the majority were female, with only a few taking part in an income-generating activity. Amongst the cases, the most prevalent infection was surgical site infections, followed by catheter-associated UTIs, and then bloodstream infections. Overall, the average total cost was about $241, and cases had a higher cost by about $144 compared to those without infection. Looking at the cost by the type of infection, we can see that surgical site infections were the most costliest to the patients, followed by UTIs and then bloodstream infections. So focusing only on the direct cost, a large proportion was food costs, followed by transport costs with minimal direct medical costs, and this is primarily because healthcare provided at the hospitals is free. The results from our regression model also show that those with infection have higher costs by about $118 as compared to the controls, which is what we saw in the earlier slides. Looking at the effect of the type of infection after adjusting for other factors, surgical site infections do remain to be the costliest infection, and there was no difference between UTIs and bloodstream infections. So in conclusion, highs can lead to higher patient costs, and there's definitely a strong need for novel IPC interventions that can reduce their impact. There's also a need for social protection policies. Thank you.